Dr. Andrew, what are the most common signs of stroke that one should be knowledgeable about?
So we have an aging population, and with the aging population, some conditions, and I'll start with the brain, can be fairly common. One of which is bleeding outside the brain but inside the skull, and it can occur without obvious trauma. It can be a little bit of a bump that you don't even think about, or a little bit of a head shake or a slip or fall. And an elderly person can have bleeding begin and then gradually enlarge over the course of days or weeks or even months. And it can come upon very subtly. It can be slight confusion or speech trouble or can't find a word, or eventually some weakness on one side or falling to one side or the other. So when a patient, especially an older one, starts to have alteration in function, even if they don't have a headache or an obvious condition, they need to go to their primary care doctor who can do a neurological examination. And if they have some of these abnormalities, it's simply diagnosed with a CT scan or MRI scan of the brain. And we can see these so-called chronic hematomas, subdural hematomas. And then they're sent to a doctor like me where very simple little surgeries are done to drill holes and drain the blood and get that person right back to a normal state. So this is a quite common situation. Another very common situation would be a pinched nerve in the neck or in the low back. These parts of our spine are very mobile. I've got some models to show, but they're very mobile. We use them, and you can see a wear and tear of the disc or of the nerve exit sites where spurs form, start to pinch nerves, causing radiating symptoms of pain or numbness or even weakness into the arms or down the legs. And these are something that patients will initially think, well, it's going to go away, and they'll live with it for a while, but then it doesn't go away or gets worse, and they'll come to their primary care doctor, who will then order the proper testing. And we have this wonderful imaging called magnetic resonance imaging, and that can show very precisely where there are areas of problems and pinching. And then they can come to doctors like me, and there are remedies. Sometimes we just use pills and physical therapy. Other times we get shots done for them with pain management. And finally, there are simple small surgeries that can be done to untether the nerves, take care of the pinching of the nerves, and get the patient resolved of their symptoms and on their way.
Do you have any suggestions for those who are just not a person who would like to have surgery? What do you recommend them to do? How do they? It's hard to change people's mind once they're set. It's like having a shot or not having a shot. And yet they just persist in refusing.
Sometimes the pain is bad enough that they simply don't have much of a choice. They just find it intolerable to live with. Some patients choose to live with a degree of pain and simply not do the movement that hurts and accommodate the condition for months to years. I've seen that in people. The problem would be when some patient has a deficit of some sort, like a loss of strength in a shoulder or elbow or arm, or bad numbness in their dominant hand, say, where they lose function because they are waiting and the pinched nerve isn't recovering, and eventually they can get to the point of no return, where even if they choose to have a surgery, that deficit will not recover because they've waited too long. Even more than a few months of living with severe numbness or weakness will usually result in permanency of that deficit. So we really hope that patients understand that significant numbness or weakness along with pain really should be brought to their primary care doctor's attention right away.